Well, we're back here at HIMSS 2019 in the UiPath booth, and again back here with Jason Warrelmann, who is heading up our healthcare industry initiative here at UiPath. Jason, it's been a pretty good show so far.
It has been.
First thing I want to go and elaborate on a little bit what we talked about already is about what RPA can bring to our customers, our healthcare customers specifically, what you're talking about. So
Absolutely.
Give me a little bit of a background on what you're talking about.
A number of key things that our clients are asking when they come to the booth, even partners, which is fantastic. One is just, what is RPA? You know, people think they know what it is, but there's a lot of misnomers. I even have people that are well seasoned in the technology business here coming up and saying, where's the hardware? Where's the actual robot walking around? Of course, that's not what it is, right? And I take joy in explaining that in a nice way, right? But we talk a lot about the computer vision, which is really the core of our product, orchestration, and of course just how easy it is to do designing. Here at HIMSS, we've actually had people come up and actually use it and actually build some bots right here live on the floor and walk away feeling pretty impressed.
So the three things, right? So we got Studio, Orchestrator, and then the robot itself.
Yeah.
And Studio, one, free, if you want to download it, which is fantastic, and start playing with it, but really easy visual thing to start working with.
We had people that left yesterday actually after downloading, or they downloaded the community edition themselves, and they were excited about taking that bot home.
So it's not just tech people. I mean, we had
absolutely.
doctors stop by.
We had
that said
doctors
that,
yesterday,
They were stopping by and saying, hey, we actually build a bot. Could you help me out and figure out what I'm doing wrong?
Yeah, we
right
did some
here at the
live
booth.
tech support
Yeah,
here right
it
at
was
the
awesome.
booth yesterday.
Okay, continue. That's unattended, but we also have attended. We're a little bit differentiated in that way that we have both attended and unattended bots, and they can work together in a hybrid model.
Absolutely. Aside from that, does it work on Citrix?
Yes.
Right. We actually got to meet with some of our Citrix partners at the show, but that's a big one, right? With our Zen app extension, people are saying, we're here at HIMSS. A lot of EMRs work on Citrix, so that's a big key point that people are looking for.
And our Zen connector, go UiPath.com. Again, another free thing that we're giving out to the community, getting people to get on RPA and start working with this stuff with Citrix.
Absolutely.
Fantastic.
And then there's security, right?
Huge.
We're at HIMSS, health information is very important, and to say we're fully secure, HIPAA aware, and used by federal agencies like NASA blows them away. There's nothing like it.
So all my data, I don't have to be worried about this when I'm talking about a product. And again, also it's a software robot looking at it, not a human looking at my data.
And it's on your platform, Brent. Yeah. So it's not out in the web. Everyone talks about AWS, they talk about Azure, everything's going there, that's fine. Yeah. But currently in the robotics world, it sits on your desktop, it sits on your server, no reason to worry about your data. But just in case, we keep your data protected, right?
Fantastic.
And then of course the last piece is, where could I use it? We had a lot of phenomenal use cases that we brought, some great demonstrations, video demonstrations, live XAML code demonstrations, and the response has been pretty terrific. Interoperability is a big question. How can we move between EMRs? We talk about gaps in care. We probably showcase gaps in care more than anything else at the show so far. Okay. Revenue cycle management. What are we doing in denial management? What are we doing in claims management? What are other clients doing in this space? And how fast are they getting that ROI is key. We also talk about patient access, being able to update those insurance cards, doing insurance verification faster, doing real-time benefit verification, and not just for the big medical community, all those ancillary healthcare segments that don't get an opportunity to use all this great tech that's here in this show. 40% of the health market doesn't get to use that. With robotic automation now, they can get a similar result even faster.
And an easy entry point too. I think a lot of times we talk about big ERPs, huge systems. Again, with RPA and our platform, you can get started doing a few areas and not doing the whole thing and dumping a bunch of money. Right?
It's absolutely amazing. So like I said, we had a medical professional come by the booth yesterday early on because she had picked up the community edition.
Yeah.
She had already figured out how to automate some of her claims management for her back office. Now she was trying to figure out how to extract signatures from clinical documentation using Abby, and she was having some trouble. She got it to work, but there was a little bit of issue, so she came here and we actually resolved her issue
right here.
Right, we were here. It's amazing that a medical professional took the initiative to try to streamline her own business using our product right out of the gate.
Yeah, and that's what's great. It's not just huge, it can be individuals, it can be across all of the different business units in the healthcare. So fantastic. And we're going to be showing more demos, as you
Absolutely.
said. We're posting those. So please make sure you continue to follow us from HIMSS here at our booth. And Jason and team of our healthcare experts will be giving you a lot more presentations on what we're doing in the healthcare industry. So thanks a lot, and we'll talk to you soon.
See you soon.